Alright, guys, how is it? How was the previous classes? So, we want to look at the peritoneum today. And first of all, I want to assure my students out there watching this video that anatomy is not a difficult subject. It is not a difficult subject at all. The most important thing is to concentrate on the most important thing. That's exactly what anatomy is. And as a medical student, when I was a medical student, and of course as an intern, there are some structures, some topic that I swear that shouldn't have been taught in medical school, that you have to learn, you have to be made to learn. For example, insertion and origin of muscles. Nobody troubled you about that. And a muscle like Anconius, pars and Sarenius, we never came across such kind of muscles. Alright? Anyway, today we want to talk about the peritoneum. So, peritoneum. So, what is peritoneum? Now, the peritoneum is sometimes it could be referred to as a cavity and sometimes as a membrane. So, but in this sense, we're looking at the peritoneum as a membrane, as a continuous, slippery, glistening, transparent serous membrane that is lining the abdominal cavity, which is the largest cavity in the body. There are a lot of cavities in the body, but the abdominal pelvic cavity is the largest cavity in the body. So we'll be looking at the peritoneum. Again, remember what I said about the peritoneum. The peritoneum is a continuous, it is glistening and slippery, like this whiteboard is glistening and slippery and a transparent serous membrane because it's producing serous fluid. Alright? So we'll be looking at the types of peritoneum. We'll be looking at the visceral peritoneum, and of course we'll be looking at the parietal peritoneum. Alright? And then we go further to look at the relationship between this peritoneal membrane and the organs. So that brings us to, in relation to the organs, remember what I said in relation to the organs? So we have the intraperitoneal organs, all right? And we have on the other hand of the scale, so in relation to the organs, the peritoneal membrane invests organs and line the wall, which we're going to see in a diagram now, and line the wall of the abdominal pelvic cavity. So on the other hand, we have the extraperitoneal organs, all right, and the retroperitoneal organs, and of course the subperitoneal organs. Now I want you to see the way I divide this. It's not difficult, it's very easy. Peritoneum. We just talked about the lining of the peritoneum. We say the peritoneum is a continuous, glistening, slippery, transparent serous membrane that is lining the abdominal wall, and as well as it's lining the organs, right? And peritoneum is divided into two types. Those that are investing the organs are called visceral peritoneum, and those that are investing or lining the abdominal wall are called parietal peritoneum. Now, in relationship, the peritoneum, in relationship with the organs that they cover, invest, can be divided into two: retroperitoneal organs and these other peritoneal organs that are extraperitoneal, retroperitoneal, and intraperitoneal organ, beg your pardon, extraperitoneal organ, retroperitoneal organ, and subperitoneal organ. Now, let us bring out a diagram, and we're going to use this. All right, let me. That is me. That's me, right? Okay. All right, that's me, though I'm not as muscular as this. Okay. So that's an individual. Okay. So what I'm going to do now at this level, I'm going to, that's a transverse section, and I'm going to lift this over here, and then you see what's going on now. So I'm going to slice myself at this level and turn this individual in such a way that you will be looking at this individual lying in supine position. You'll be looking at this individual from the point where I have sliced him, this way. So that's what we're going to have. So the structure we're going to have now is an individual who is lying supine. Okay, that's the individual abdomen, and that is the so this is the back, and that's the abdomen. So we may have the head this way and the legs facing the other way. So this is just, you understand what I've just done. So okay, so we have this now. That's the abdomen, abdominal muscle, the wall, anterior abdominal wall. That's the anterior abdominal wall. And we have that, back muscles. I'm sure you understand what that is. So this individual is lying supine, so that's the level of the bed that the individual is lying on. So we have this now. So I'm going to use the screen marker to illustrate organs. So these are the organs. That's the stomach. Okay, that's your spleen. Okay, and here you have your vertebral body that is covered by muscles at the back, transverse process, and of course the spine and the neural canal. This is the vertebral body. And you know that muscles are attached to all this. These are muscles, back muscles. And that's your kidney. And that's the other kidney on the right side. The arch of aorta. And the inferior vena cava. So now we're going to see what's going on here now. We have, okay, so we want to talk about the visceral peritoneum and the parietal peritoneum. So what is lining the inside surface of the abdomen is your parietal peritoneum. That's your parietal peritoneum lining the inside surface of the abdomen, the anterior abdominal wall. Okay? It's lining everything. That's it. It's lining everything. Okay? And at some point it reflects away from the wall and invests organ. It invests organ. That's the organ it's investing. And it can also reflect from the organ and invest another organ. And this can also reflect and invest another organ. And then we have this. So it's also covering completely this organ there. And that's exactly what we have. And that continues all the way backward. So what we have now is very interesting. So we have, this is a stomach. All right, I'm going to label this as a stomach. Now in relationship, this organ in relationship to the peritoneum is an intraperitoneal organ because it is completely, almost completely invested by the peritoneum. So that's an intraperitoneal organ. And this, because it is invested in the organ, it is a visceral peritoneum. Now, this portion here that is lining the wall is the parietal peritoneum. And here we have reflections from the abdominal wall to organ, and that becomes mesentery. Mesentery will convey neurovascular structures to organs. Similarly, neurovascular structures can also be conveyed from this mesentery to this organ. Now this is a spleen. That's the spleen on the left hand side. Now this we have is a ligament. That's a ligament called the hepatoduodenal ligament. Hepatoduodenal ligament. And here you have your portal triad. There are three structures that are invested by that structure there, and that is referred to as portal triad. The portal vein, the hepatic portal vein, the bile duct, and the hepatic artery. They are covered there. And there is a ligament here. So remember what we said before, that anatomy is carpentry of words. So you bring one word, you fasten the word to another word, you make a new word. So this is the renal structure, or the renal organ, the kidney. So the renal organ connecting to the spleen, you have the splenorenal ligament. So this is a splenorenal ligament. Splenorenal ligament. And here we have another ligament. Same thing again. That's a spleen. That's a gastric organ. So we have the gastrosplenic ligament. That's a gastrosplenic ligament. So we see here that we can bring a lot of things from this structure. We say that we know what the parietal peritoneum is. We know what the visceral peritoneum is. So the spleen is an example of a visceral peritoneum because it is completely invested by the peritoneal layer. The stomach is also an example of an intraperitoneal organ, and the intestine as well. They are all intraperitoneal organ. What about extraperitoneal organ? It means they are outside the peritoneum. They're not invested by the peritoneal membrane, neither are they inside the peritoneum. Rather, they are outside. So when you're outside, So we call these three as structures that are outside. So they are outcasts, right? So they are outside the peritoneum. Okay? So it's either it is extraperitoneal structure, or it is a retroperitoneal structure, like the kidneys are retroperitoneal structure. The subperitoneal structure, like the bladder, as subperitoneal structures. Okay? Now, interestingly, ligaments are formed from these anatomical arrangements, and foramens are formed. So one of the foramen that is formed here is this one here. That's a foramen, all right? Because you can push your finger right through there, and it leads you into a space or a sac, which you're going to see later on. It's a lesser sac or the omental bursa. A lesser sac or the omental bursa. Now that foramen, surgeons use that foramen to identify, to look for blindly the common hepatic artery, where they have to look for the right hepatic artery as they are looking for the cystic artery. They're looking for the cystic artery, so they go blindly looking for the cystic artery because they want to ligate the artery during cholecystectomy, a surgical removal of the gallbladder. So this foramen is called the epiploic foramen of Winslow. So epiploic foramen of Winslow. Okay? All right. So at this stage, I think we understand what this is all about. There shouldn't be any mix-up here. Now, the other thing we need to know is peritoneal cavity. Where is the peritoneal cavity? The peritoneal cavity is a small space, a very little space. It may look so big, but remember, when you drive into the peritoneal cavity, you are a surgeon and you take your knife and you go all the way laparotomy. You open up, okay? You are into the peritoneal cavity because you just opened the parietal peritoneum. When you open the parietal peritoneum, the space between the parietal peritoneum and the visceral peritoneum is the peritoneal cavity. It's very small. There are no, in literal sense, big spaces like this in the stomach, in the abdomen rather. So what we have is we have a lot of intestine, large intestine, small intestine, everywhere. So we don't have that space. The other thing we need to talk about, or we need to know, is the peritoneal fluid. The peritoneal fluid is produced by the mesothelium. Mesothelium is a simple squamous epithelial cells that is lining the abdominal wall. So it means that it is peritoneum, yes. It is a continuous, glistening, slippery, transparent serous membrane. Okay, the serous membrane produces serous fluid, and it is made up of cells called mesothelium. And mesothelium is an example of a simple squamous epithelium. And because it is a cell, these cells are lined or chucked against each other to make a very large, big tissue that is covering, cementing the wall of the abdominal pelvic cavity. Alright? Now, if you understand what a cell is, cell has a nucleus, and these cells have nucleus, and the nucleus would definitely have DNA, and the DNA would have to do transcription, and there would definitely have to be a translation of what has been transcribed. Okay? And of course, whatever has to be transcribed, you mean you want to produce something. So it goes all the way to the endoplasmic reticulum. And whether it is smooth or rough endoplasmic reticulum, something has to be synthesized. Now, what is it that's going to be synthesized? Fluid. So it is a watery fluid that has electrolytes in it, and that helps to lubricate organs as they match against each other inside the peritoneal cavity. All right? So it is important to know that sometimes you can get excessive synthesis of these peritoneal fluid and you can get ascites. Ascites can also be caused by other things like infection can cause ascites. If you have increase in portal hypertension, you can have ascites. You can also have ascites as a result of congestive heart, especially right-sided heart failure, congestive heart failure. You can get ascites. You can also have ascites if you lack protein. All right. So all of these can lead to massive collection of fluid within this large cavity. All right. Okay. Now remember when we did the abdominal wall, we said that the abdominal wall has ligaments. Okay. These ligaments are important. We just made mention of some of these ligaments here, and there are ligaments that are lining the anterior abdominal wall, okay, like the median umbilical ligament. We talked about it in the previous class, in the previous video. The median umbilical ligament, the medial umbilical ligament, and the lateral umbilical ligament, and structures that they invest or cover. Okay, the median, which is the one that runs on the midline. There's something else I did not put right here, which is the linea alba. That's the linea alba. Do not forget that the linea alba is formed as a result of the coming together of the aponeurosis of the abdominal muscle. The abdominal muscles, the external oblique muscle, internal oblique muscle, and transverse abdominis muscle all have aponeurosis. What the hell is aponeurosis? Aponeurosis is just a modified fascia that becomes very thick because a muscle is meat. So the extended end of a muscle that needs to go through abrasion and trauma has to become tough. All right, like your palmar aponeurosis. It's an example of a fascia, but becomes modified. These fascia right here, which is the retinaculum or the flexor retinaculum, are all fascia because a lot of movement has to be done in that region, so those fascias has to be modified. And it's the same thing that happens right here. The linea alba is as a result of the coming together, crisscrossing of the aponeurosis of your external, internal oblique muscle and transverse abdominis muscle right here in the midline. And that is why you don't have blood supply in that region. Surgeons can take advantage of that region and go into the abdominal cavity during laparotomy. Okay, now the next thing we want to look at is we're going to take off this diagram and we want to look at the peritoneal formation. So the next video we'll be talking about the peritoneal formation, right? Good, thank you.